This short video will provide instruction for MR technologists on how to properly set up a subject in order to perform the MR elastography exam of the liver, consistent with the requirements of the QIBA profile. The subject will be scanned in the supine position. Passive driver placement is critical for the success of the MR elastography exam. The driver is placed over the right lower chest wall at the level of the xiphoid process of the sternum, right-left centered at the mid-clavicular line. The passive driver is then held in firm contact with the body wall using an elastic band. The passive driver is connected to the active driver, which is located outside the scan room via a plastic tube. It is critical to ensure the connection of the plastic tube between the passive and active drivers. This video shows the passive driver placement. First, the technologist feels for the patient's xiphoid process of the sternum to determine the superior-inferior placement of the driver. Then the driver is shifted to the subject's right side, centered at mid-clavicular line, and is securely fastened to the body using the provided strap. Images should be acquired with the subjects at end expiration. The technologist shall acquire axial sections for MRE positioned at the level of the widest transverse extent of the liver, avoiding the lungs, liver dome, and inferior tip of the right lobe. If possible, the technologist shall use an EPI MRE sequence at 3T. The technologist should also confirm that the subjects are scanned with the same parameters and software during follow-up exams as the baseline liver MRE whenever possible. The technologist shall confirm the magnitude images show signal loss in the subcutaneous fat just below the passive driver placement. This confirms that the mechanical waves are being applied. In addition, to determine technical success, the technologist shall confirm that the phase images, also known as the wave images, demonstrate shear waves in the liver. You should also review the post-processed elastograms with or without the confidence map as available to confirm technical success of the exam. If the exam was not technically successful, it should be reacquired if possible.